आज मैं गौरव कटारिया आप सबका स्वागत करता हूं हमारे एनडी आयुर्वेदा के विंग के अंदर। और आज हम उस चीज़ों पे उन सवालों पे बात करने जा रहे हैं जो हर एक पेशेंट के मन में रहते हैं, कि वो जानना चाहते हैं कि आज हमें क्या क्या दिक्कतों का सामना करना पड़ रहा है, कि हमारी टाइमली डॉक्टर से बात हो जाए या हमारी यहाँ के कॉलर से बात हो जाए। तो सभी प्रयासों को आज हम कवर करने जा रहे हैं। हमारे यहाँ पर आज प्रॉपर टीम है जो आपको बताने जा रही है कि आज हर एक सवाल का जवाब जो एक पेशेंट के मन में रहता है, उन सवालों के सभी जवाब आज उनको मिलने वाले हैं। तो मैं चाहूँगा कि आज यहाँ पर जो हमारी टीम बैठी है, तो उन सभी सवालों के जवाब उनके ज़बानी आपको मिल जाए।
Please tell us something about ND Ayurveda.
When it comes about ND Ayurveda today is a organization more than a century old. When we talk about the fact that it's more than a century old organization, it is totally attributed to the fact that ever since ages, the Vaidya Pratha, in which father is a Vaidya and whatever he gradually learns with experience is passed on to the next generation, and further knowledge is accumulated, was followed in the culture of ND Ayurveda. ND Ayurveda was not known as ND Ayurveda in itself from that time onwards. It was in the village Samnoli in Himachal that this organization developed as a very basic small unit. Gradually, as generations passed by, modernization took place, and finally it was in the year 1990 that the organization came to be known as ND Healthcare. This ND Healthcare was then gradually transferred to Punjab, and here gradually with the passage of time and as per the demand of the modern society, modernization as well as doctors from all spheres were added in this organization, and today in itself this is a global chain under the brand Nirogam with more than 100 doctors on panel from all spheres: allopathy, Ayurveda, Unani, homeopathy, naturopathy, Chinese herbology and paramedical fields also. So this is today the basic structure of ND Ayurveda. And when it comes to the ideology of ND Ayurveda, it primarily is Swasthasya Swasthya Rakshanam Aturasya Vikar Prashamnam cha. ND Ayurveda believes that if a patient is healthy, we should always indulge in such practices which improves and maintains the health of that individual. And if a patient catches disease, the disease needs to be treated, it needs to be cured with utmost sincerity. And when it comes to treatment, we are here following a holistic approach. That is, it doesn't matter whether allopathy is used or Ayurveda is used or homeopathy is used or naturopathy is used or Unani is used. What matters is the health of the patient. So all these things are very nicely utilized for the betterment of our patient here at ND Ayurveda. Yes, Surendra.
What type of pathies do you practice, and what is the type of medication you prescribe?
As I just told you, that when it comes to pathies, all the major pathies today which are famous in the world, primarily speaking, Ayurveda, allopathy, homeopathy, Unani medicines, Siddha, Chinese herbology, they are all being used over here very nicely incorporated with each other for the betterment of the patient. So all are working in synergism with each other. It's not a matter of naming a pathy, it's a very nice bunch of pathies which we are using for the betterment of our patients. Yes.
Doctor, do you have qualified doctors with you?
Yeah, sure. This is a question which generally comes in the mind of any individual going for treatments today. And when it comes to qualified doctors, it is something which is a very basic requisite today for setting up of a simple clinic also in a reputed area. And since it's a global firm, we are having a team of doctors. It's not just one or two qualified doctors we are having. It's a full team of doctors, specialists, super specialists from each and every sphere are registered with government who are working as a team for the betterment of patients here under one roof.
How much time would it take for a patient to be cured in all the bowel diseases, and can you offer a guaranteed treatment?
See, sir, when it comes about offering a particular time frame for a disease, it is just marketing strategies that people are today following for selling of things. We cannot comment on the exact time required by a person for curing his or her ailment. The major reason being, in any kind of ailment, there are multiple factors which are important for adjudging the condition of the patient, the time which would be required for treating that patient, and as far as providing cure or guarantee is concerned, there is no person on this earth who can actually guarantee anything until and unless you know about the details of a particular thing, a particular ailment. How can you guarantee? Guarantee is something which is against the medical ethics itself. Indian government, Ayush, which is the regulatory authority for Ayurveda, Unani, Siddha, Homeopathy, and itself legally bounds each and every doctor that guarantee is something which should never be used before providing treatment to someone. Because talking about human body, undoubtedly it is a machinery made by the God and one of the best machineries, but what exactly a medicine is going to do in the body, how quickly it is going to act in a particular patient is totally independent from the fact how quickly and how well it acted in a number of patients before him. Each of us is having an individual kind of body. So what exactly and how quickly a medicine is going to act in the body is something which cannot be adjudged at all. Yeah, one thing for which we can provide surety is that here at our center, we are not making fake commitments to anyone. We are working with sincerity, whether a patient is taking treatment from us or not. That is not our concern. Our concern is when a patient is approaching us, we need to and we should provide him the true and actual picture of the thing, that what exactly is the condition, and that is what we do over here.